Good day, everyone. I'm Rotary Regina Minyorombi, the current president of Rotary Club of Bonny. I'm here to talk about the Rotary Family Health Days. The Rotary Family Health Days is ongoing now. Rotary Action Group for Family Health and AIDS Prevention with the Bill of and Melinda Gates Foundation in collaboration with Rotary clubs and districts in Nigeria, ministries of health, private sectors and NGOs is having its annual free nationwide health services event tagged Rotary Family Health Days starting from 24th through 26th of October 2022. On these days, Rotary International tends to reach out to 150 people across Nigeria through its Family Health Day celebration. It was officially flagged up before the commencement days. This is a grassroots program and it is very important. This is drawn in all the communities in Nigeria. As part of the 3 days program, the Rotary Health Days focuses on providing a comprehensive and holistic health service to both young and old. Critical issues such as HIV and some deadly diseases were addressed. The 3 days activities include the following: polio immunization, deworming of children, health talk to mothers, malaria screening and treatment, HIV testing and counseling, hepatitis B and C, diabetes and glucose level screening, vitamin A administration, hypertension screen, cervical breast, buttress cancer screening, distribution of insecticides, treated mosquito nets, distribution of sanitary pads for girls, COVID-19 awareness sensitization, and family planning counseling. On this note, I want to call upon my classmate, Rotary Uchechukwu, the president of Rotary Club of Bonny Island.
Okay, good afternoon, sir.
Good afternoon.
So please, can you introduce yourself?
My name is Rotary Uchechukwu.
Okay, thank you. So can you tell us what is going on here today? Tell us the group and the activities and how it's beneficial to the community.
Okay, thank you very much. This is actually a Rotary Family Health event being organized by Rotary Action Group for Family Health and AIDS Prevention in conjunction with Bill and Melinda Gates Foundation. Also collaboration with Rotary clubs and districts in Nigeria, ministries of health, private sector, and a couple of NGOs. Yeah, it's an annual free nationwide health services with the inscription or the theme Rotary Family Health Days. It will run from 24th to 26th of October 2022, actually to mark the World Polio Day.
Okay.
And, the activities, a couple of activities are lined up, which include some critical issues around HIV, polio, and other diseases. The services will be free, and we will also be doing polio immunization, malaria screening and treatment, HIV testing and counseling, hepatitis B and C, diabetes and glucose level screening, and a couple of other elements that will be screening and actually providing treatment to patients. It's actually organized by Rotary Club, District 9141.
Okay.
This is for River State, and this one that is holding in this health center is being organized by Rotary Club of Bonny and Rotary Club of Bonny Island.
Okay.
Thank you very much.
So please, can you introduce yourself?
My name is Adabota Nicholas Hart.
Okay, you're welcome, ma'am.
Thank you.
So please, can you tell us why you are here?
I'm here in respect of a Rotary Free Medical.
Okay, so you're happy. I can see you're happy.
Yeah, I'm happy.
I guess that's the mood you're at today.
Yes,
Okay, so how has the medical been?
It's a good one because for some time now I've been feeling some pains which I've been taking some drugs to no avail. But now it has given me an opportunity to know that what I'm taking the drugs for are not really what was my situation. So now I've known that a new sickness is being in my body and I'm taking it for something else, treating malaria when it is not malaria. So I'm grateful for this opportunity.
Okay, so I can see nets in your hands. So can you show it to the camera? Yeah, okay, so it therefore means that you are going home joyfully. So what do you have to tell the Rotary Club of Bonny?
Well, I tell them thank you very much. Thank you very much again. At least they have given so many persons an opportunity to have free drugs, even the ones that cannot afford or the ones that don't have much money to afford. They have little money to afford, but the free ones, they can afford the ones they can buy. So I appreciate God for them. I thank God so much for them. They are doing well.
Thank you very much. You're happy. Thank you, sir.
All right, good afternoon, Doc.
Good afternoon.
All right, so can we know your name, please?
My name is Dr. Fortune Isobonye, the medical officer in Bonny Primary Health Center.
All right, thank you so much. All right, so I'd like to find out from you, the Rotary Club has been having a program here in your health center where they've been giving out some free medical care and some treatment to residents here in Bonny Island. What do you have to say to Rotary Club and to well-meaning individuals who have not perhaps found themselves doing such things as well?
Our Rotary Club has always been a partner in healthcare management. Even in Bonny, personally, they went more than they could to even try getting us the rotavirus that was actually removed from our immunization schedule. The reason why it was moved was just finance. So if they are going that extra miles to make sure they are bringing it back, thumbs up for them. Rotary Club has always been there for people wheresoever they are, mostly when it comes to healthcare. And for this particular move that they just did with this medical outreach, nobody expected it. Even after everything they've been doing for us, they still came with this medical outreach. They were mostly based on the 5 for the immunization, but now they took a bold step to step up the game and said everybody above on the 5 too can come. With the economy right now that is not playing fairly on everybody, when the Rotary Club brought this idea of doing this outreach, plenty persons were surprised. Even we, the doctors, we were taking a surprise.
Wow.
They did not even tell us that they wanted to do this. They just came. The first thing is the diagnosis. Even though they don't have everything available, you can actually tell the patient or the client that this is your problem, this is your problem. But unfortunately, we don't have those drugs. But these are the drugs, or this is what you should do. At least that's the contact point of telling the patient how his or her health is, the state. So that is a great one. And I'll say thank you and God bless all the hands that actually made this outreach possible.
All right, so you are a health professional and we are in an industrial area. Can you tell us what's the best health measure that an average Bonny resident can use to mitigate the effect of the air pollution we face here in this industrial area?
Naturally our body has its own way of taking care of all those things, the pollutants, every other thing of the immunity. But Bonny being a strategic area, Bonny has its goods and the cons. So many persons come to Bonny, just as when the COVID started. The COVID was not here during when the lockdown was there. But as the lockdown was lifted from other places and people started trooping into Bonny, that's when the COVID came. But the gas flaring is one thing that it's everywhere. On a more serious note, even if you compare Bonny to other places, you say Bonny is fairer. Yes, the gas pollution is there, but it's not as crazy as outside when other pollutants are there. Bonny is just a confined area, and luckily the ocean, the sea breeze mostly pushes these things away from us. Yes, the acidic rain is there. We cannot take rainwater anymore. It's just to have your routine 3 months monthly medical checks. You come, you can just run your do the investigations, let the doctor examine you, complain. Even if you don't have complaints, you can just come check the integrity of your organs, depending on even the age you are. So with that, I think for people above 40, like the Rotary Club actually even went a step further. I was even forced to do my PSA. Once you're above 40, you'll be thinking of how to check the integrity of your prostate as a man. I was forced to do mine. At least with that awareness, anybody that sees their own that it's reactive, you go further to check. Nobody wants to die. But you've put the awareness into the person, even though you cannot take the person 100% where the person should go. But the awareness is there. They said, and somebody that is aware does not really miss road. Ignorance is not bliss.
All right, thank you so much, Doctor, for joining us on Think Tank. This is Think Tank TV. Do well to subscribe. Follow us on all our social media platforms, and we're going to be here to serve you. Thank you so much.
You're welcome.
Imagine Rotary bringing all this to be. Rotary is indeed good. We pray that we'll continue to do this, even in this Rotary year. Kudos to Rotary Club of Grand Bonny. Kudos to Rotary Club of Bonny Island. Kudos to District 9141. Kudos to Rotary International. God bless everyone. Thank you very much.